Hello everybody and welcome back to my channel. My name is Elizabeth, also known as Nurse Zabe, here on YouTube, TikTok, Instagram, and I am a labor and delivery nurse, postpartum nurse, certified childbirth educator, and mom to 3. Today's video is going to be all about laboring with an epidural. A few videos ago, I made a video about how to labor without an epidural. But if that's not necessarily your cup of tea and you are feeling like I am an epidural person through and through, then this video is for you. I'm going to give you some tips and strategies to utilize that epidural. It's going to help your body to relax. That is going to aid in dilation to help bring your baby into the world. Epidurals are not bad or evil. They are an amazing tool that we have in our labor toolbox. And I'm going to tell you what to expect with an epidural, how we can best utilize that epidural as far as helping your baby be born. So definitely stick around. Let me know if you got an epidural, how dilated you were when you got an epidural in the comments below, and make sure to give this video a thumbs up, subscribe, share, all of those lovely things that help with our algorithm. Let's go ahead and jump into it. So when we're talking about a labor epidural, it is a continuous infusion of medication into the epidural space in your back that is going to provide a bit of a motor and sensation blockade from about your navel, your belly button, down to your feet. And so what this can do is take contractions that are feeling really intense, really overwhelming, and painful, and bring that level down to ideally no pain, so that you are able to still change position, but sleep and rest and cope through your labor contractions. An epidural is a great tool to use if you have moved from coping through labor to suffering either physically or emotionally during labor, because as Penny Simpkins says, no one should have to suffer during labor. So, when should you get an epidural? There is no perfect time. There is no right time to get an epidural. It's really dependent on what is going on in the situation. Now, as my perspective as a labor nurse, my goal roughly is active labor. So in that 4 to 6 centimeter mark, for me, I find to be a really good place for my patients to get an epidural. If I can help them cope through labor until that point, that is the goal. If I can help them continue to change positions and make sure that baby is over on the left side and getting to be engaged in the pelvis, that is a great time to get an epidural, because then as you relax, baby will continue to rotate into that really good OA position, which means that their back is facing forward. That is the easiest position to push out a baby. But a lot of things are going to affect whether this is the right time for you to get an epidural. Are you being induced or augmented with a medication that's making you need continuous monitoring and reducing your movement? Is your baby in a position that's causing contractions to couple, triple, and you're not feeling like you're getting a rest, and it's really making it difficult for you to cope through labor? So there is no perfect time to get an epidural, and I will be the first to tell you, I got an epidural with my first baby at 3 centimeters because I had moved from coping into suffering, and I had tried to make my labor nurse complicit in an illegal drug smuggling ring to give me more IV narcotics. Of course, she said no, but didn't stop me from telling her that I would tell no one if she immediately gave me another dose of fentanyl through my IV. I needed an epidural, and it was the right choice for me at that moment. If we can maximize fetal positioning before the epidural, I always think that that is a great place to start. And studies show that delaying the epidural in order to avoid a cesarean birth is not necessary and is not needed, and is in some cases very torturous to you. So we don't want to do that. If you think you need an epidural, then that is the time to get one. But that being said, you still need to do some childbirth education classes. You still need to have a labor toolbox full and ready to support you in labor, because even if you're planning on getting an epidural, there will be moments in your labor where you are needing to have some coping strategies outside of getting the epidural. Even if that's just while you're waiting to get the epidural or waiting for the epidural to work. But most of the time you're going to be doing some laboring at home or walking around in the hospital during early labor, during an induction process before it's time to get the epidural. We need to be having consistent contractions and cervical change to get an epidural. We need to be in labor to get an epidural. You can't just say, I'm 39 weeks and I'm tired of being pregnant, let's get an epidural. Certainly felt that way myself, like aches and pains, I would love for them to be gone, but not always going to be an appropriate solution. So you need to still be prepared for laboring some without an epidural. particularly because sometimes epidurals might not work 100% as quickly as we would hope. Sometimes they might have an area where the epidural isn't working as well, or you might need the epidural to be given extra medicine or to be even replaced because it's not working appropriately. So we still want to have those coping strategies and techniques that I talked about in my laboring without an epidural video to kind of get us through to getting an epidural. Just because you want an epidural does not mean that you are not a fabulous candidate for hiring a doula if that's something that you'd like to do. Okay, so you've decided to get an epidural and maybe you're feeling really stressed and anxious because needles are not your favorite thing in the world. I think that would be most people. Here's the good news. You should not be in pain from the epidural needle. As we're getting ready to get the epidural, they're actually going to be using some lidocaine in your back to numb everything up. This feels like a bee sting, and bee stings aren't fun, but when you're having intense labor contractions, bee stings really aren't quite that bad. Most of my patients don't even jump or make a noise when we do that lidocaine injection because they're so focused on getting through the contractions that it really feels like nothing. After that, the epidural needle should just feel like a little bit of pressure in your back. You should not feel anything sharp or painful. And if you do, you definitely want to let the anesthesiologist know. And there's also a very short interval of time when you need to be very still. Your anesthesiologist is going to do their best to work in between your contractions. But if we have to do it during a contraction, we are just going to talk through it, say every bad word in the book, and get through that one contraction until the epidural gets to where it needs to be in your back. Once the epidural needle is in the right spot, then a catheter gets started through and nothing sharp gets left in your back. After that epidural is placed, it's still going to take a little bit of time for you to get fully comfortable. You'll notice that it kind of starts in your toes and it works its way up to your belly. So you might start to feel heaviness or tingling in your legs, almost like they've fallen asleep before it gets up to your belly. Once we get that epidural working, typically they'll have you tilted to one side, mostly kind of flat-ish, sitting up a little bit because it is gravity dependent to get it to where we want. Then we'll start turning you from side to side. Movement is magical and movement still matters with an epidural. In fact, maybe it matters even more so because we are going to be helping you change positions. Every 20 to 30 minutes is kind of our goal, which is annoying because I know you were banking on a nap. Even with a fully functioning epidural, you might still feel some things. Some people will still report feeling the tightening of contractions, or they might have one area where they're still having a little bit of discomfort in their back or their hips. If you're having back labor, sometimes the epidural does not work as well to reduce that back labor. Helping to reposition that baby might help reduce that back labor though. So we're going to be working on that as well. But don't go into getting an epidural thinking that you are going to be feeling absolutely nothing after it's placed. It should definitely bring your pain score way down. Some studies show it brings it down by 2 to 3 points, but people are still reporting that their pain relief was good or excellent. And from my experience, it mostly brings people down to that 1 to 2 range, where maybe they're still feeling some tightening, but in general, they are not having to still breathe through their contractions or anything like that. That is ideally where we want that epidural to bring us. But everybody's going to be a little bit different. Some people will feel absolutely nothing, and that's okay too. Once you get an epidural, there are going to be some things that are different. So if you were doing intermittent monitoring before or listening with the Doppler to the baby's heart rate, now you will be on continuous monitoring. That means that we will be watching the baby's heart rate and the contraction pattern. We also will be closely monitoring your blood pressure because the biggest risk with an epidural is that your blood pressure could drop and you are going to feel miserable, and baby could also show us with their heart rate that they're getting less blood flow. Good news is we can give you fluids, we can change your position, and we can also give you medications to bring that blood pressure back up. So it tends to not be an issue that leads to any really bad outcomes, and that's why we have the blood pressure cuff on. The other thing you probably won't be able to do is empty your bladder. You're more than welcome to try and pee using a bedpan, but most of the time people aren't able to fully empty their bladder, and because the bladder can kind of impede fetal head descent, and if it gets over full, stretch out the ligaments and have issues with incontinence later, we will be either doing a catheter that goes in and out, aka an in and out catheter, or leaving a catheter in place based on where you are in your labor and the policies and procedures of your specific facility where you are delivering. The good news is with that catheter, it's not going to be anything that's super uncomfortable because you're going to be nice and numb. You might feel touch, but it should not be painful for that catheter to go in. Also, we'll be hooked up to IV fluids that will be running continuously just to make sure that your hydration stays where we like it. Many facilities will encourage you to kind of stick with clear liquids after this. Some will say just ice chips, but I think clear liquids are important because you can get a lot of sugar, energy, and carbohydrates from clear liquids. Now, when it comes time to push, you may have heard me refer to when you feel like you need to push your baby out. You feel a lot of pressure, like you have to poop. When you have an epidural, you may or may not feel this sensation. And often I liken it to feeling the LaCroix of pressure, right? A hint of pressure where you're like, whoa, I think I feel some pressure in my bum. I think I feel a little bit of rectal pressure. Often that's your baby's head. And with the epidural, what we tend to do is wait until you're feeling that pressure sustained, more intense with contractions, but sustained throughout before we kind of check to see if you're fully dilated. That gives your baby the most time for the contractions to bring baby down and to rotate baby before we start pushing. Because while getting an epidural can increase your length of labor marginally, it does typically increase the duration of pushing by a little bit of time. And so we say about 2 hours is our average length of pushing for a first baby. With an epidural, that can go up to 3 hours. And we are recommended, as long as your vital signs and everything look good and baby's vital signs and everything look good, to continue to push for up to 4 hours with your first baby. What we need to know with that is that there is sometimes some things that we can do if you're having a hard time pushing with the epidural. We need to be changing positions every 15 minutes or so when we're pushing, even with an epidural. We shouldn't be flat on our back pushing for the extended duration of time, because changing position and finding a position where you feel the most powerful pushing will help bring your baby down faster. The other thing that we might consider is waiting until you're feeling that intense urge to bear down before we start pushing. Often a little bit of passive laboring down and continuing to obviously be really intentional with position changes can help decrease your length of pushing with an epidural. There also might be a time when you and your provider decide that you would like to turn down or turn off the epidural. Maybe you've been pushing and baby is not moving as we would hope, but studies do not support that turning off the epidural or down the epidural reduces pushing time. So it might be that we just need to get baby in a better position, and that will make pushing more effective. But you're going to have a conversation with your provider figuring this out. Now, if we turn the epidural off, if that's the choice that you and your provider decide to make to help with your pushing efforts, it's not like it goes off and all of a sudden you are feeling everything again. It is going to slowly wear off, and we can always adjust it as that happens if it gets to the point where turning it off doesn't work for you. The other thing that you will experience with pushing is something called the ring of fire, where you feel that kind of burning, stretching sensation around your labia, perineum, as baby's head is coming out. That ring of fire is a really good indicator if you don't have an epidural to be like, ooh, let's slow down. That sensation feels weird and different, and that allows the tissue to stretch. If you do have an epidural, good news is you might not feel that ring of fire. You might still feel some stretching, but it should not be as intense, or you might not feel it at all. And if you're not feeling it at all, that is when you really want to be listening to your provider as they are encouraging you to give smaller, littler pushes, or even breathing and let the contraction bring baby's head out to reduce our risk of significant vaginal and perineal tears. Like I said with pushing, it can take a little while, and we want to be changing positions every 15 minutes. There's a multitude of reasons why we do this, and they're actually both for your health and for the benefit of babies. Changing position is going to help baby to rotate, it's going to help them descend to the pelvis, it's going to have better heart rate tracings for baby. Changing position for you will actually decrease your risk of lower extremity nerve injury. So sometimes when we're asleep, or when we're just kind of doing our thing, oh, my leg feels a little weird falling asleep. Okay, let me change position. If you've got an epidural, you might not get that feedback. And so we have to be really conscientious of not pulling your legs back too far, not leaving your legs in stirrups, not grabbing and pulling hard behind the knee or overextending things, because we can actually do damage to the nerves in your legs. That can lead to short-term or long-term consequences with nerve injuries in those areas. And then once your baby is born and the placenta adds out, we will turn off the epidural, but it's going to take a few hours for it to get completely out of your system. So just know that you might still have dead or heavy legs, and you should not be getting up by yourself. We will help you the first time you get up to the bathroom, but there still might be a little bit of time where you have a hard time peeing or a hard time walking, and your nurse will be assisting you in both of those things to make sure that you are happy and healthy and safe. I hope this video was helpful in figuring out laboring with an epidural. I know we hear a lot about how to do it without one, and maybe not so much on how to do it with one, because there still are some tips and tricks that can be helpful. Definitely let me know if you had an epidural experience that you'd like to share down in the comments below. And until next time, bye guys!